Yeah. Okay. All right. Now we're operating. Here we go. You know what? This is it's user error, clearly.
Yeah, my son, whenever he's being really like, hey, Mom, do you have class tonight? When do you hear what I have?
Right.
What do you want? Well, you don't have to have 5 bucks on you.
Yeah, right. He did. You need anything? I go, no. He goes, oh, hey, can I use your credit card to fill up my gas tank?
Right now I'm taking care of my friend's little kid, that teenager, and Gracie wants to do all day, and I said she's so sweet, and I'm like, what do you want? Just give me straight. And she's telling me without asking that she's invited 7 other kids. And I know. And they come and I can't put them in the sugar. Go ahead. They're going to talk to you if they let them know. And they also have a gate today, not today, because they cannot come because I have to. I said, no, let them know that they are not welcome. Because I am not meeting with 7 breaths. I'm sorry. All right.
That's why I think there's something to reincarnation, you know? Like, I must have been a real royal prick in another life. You know what I mean?
Really good kid.
Huh?
My mom said I was a really good kid. I didn't play Albuterol until I was 18. That's when I started,
Yeah. Here's the thing, and this is no joke. No. My mom told me, basically on her deathbed, she goes, you never gave me a gray hair. And I didn't. I was a good kid. I really was. I maybe should have been a prick. Okay, why isn't this working? Oh, here it is.
My daughter, she's very dramatic and kind of whiny, but I think that's just a 9-year-old girl. No, you just have to say, cut it out. I don't want to hear it. Shut up. Oh, no. Because they go into school and they're not even mine. They only with me for 3 days. I'm like, I don't want to hear it. In your room, when you're done acting like that, you can come out. And she just never comes back out. I'm like, well, oh, I know. I decided at age 16 that I would rather die than have one. Oh, God.
They are a lot of work. They're a labor of love.
If they drive me crazy, take my own steps.
Okay, here we go. Ready? Okay. So, what does epinephrine bind to? Good. You almost finished that before I had it written. So, if you stimulate a beta receptor, or you stimulate a receptor, it's called an agonist. You got me? If you block it, it's called a what? So do you want to block or stimulate beta-2 and beta-1 receptors in the bronchioles when you have asthma? So you will now learn the term a beta-2 agonist. And a beta-2 agonist will stimulate beta-2 receptors in the smooth muscle of the bronchiole and cause that muscle to relax. So what will the bronchiole do? It will dilate. So drugs like albuterol are referred to as sympathomimetic. They mimic the sympathetic nervous system. What does the sympathetic nervous system do to arteries? Constricts them. What does it do to the bronchioles? Dilates them. Do you see that? Now watch. When epinephrine's around or the sympathetic nervous system is stimulated, what's going to happen to your heart rate? What's going to happen to your blood pressure? Are you going to be able to sleep when you have... What is this? Keep this. What? Okay. Maybe it'll never come back. Right? So, when you take albuterol, it mimics epinephrine. So what are the side effects of an albuterol inhaler? Shakiness, elevated heart rate, right? Jitteriness, nervousness. There you go. That's why if you understand what a drug does, you'll know the side effects. Rock on. Right, I'm going to give myself a high five. Yeah. You know what? I should record that. I'm going to record myself giving myself a high five, and I'll put it on YouTube. Okay, now watch. Watch. What is Indorol? I'll give you a hint. It sounds like Beta blocker. It's a beta blocker. Albuterol is a non-cardioselective beta blocker. It blocks all beta receptors. So if you have asthma, do you want to block Beta2 receptors in your bronchioles? No, because if you have an asthma attack and you suck on the inhaler, it ain't going to work. That's why Albuterol is contraindicated in anyone with asthma. Oh, that was extra credit too, huh? Well, you showed up, right? So, yeah, you should benefit. Yeah. You're sitting there like you're watching a movie or something like that, like a scary monster movie. Like, how many people got that? Okay, we're killing this. Hey, watch. So, what are the 3 types of medicines used to treat asthma? No, don't say that. Don't say that. I don't want that. No. No. You want a Beta2 agonist, right? And then you want a, watch, what caused the asthma in the first place? What suppresses your immune system? Steroids. So they give you steroid inhalers, right? If you got a little kid with really bad asthma, then they're going to take him to the emergency room. They're going to put him on a little nebulizer, albuterol nebulizer, and if it's really bad, they will give them IV steroids called Solumedrol. Say yes. Then they give you, watch out, they give you a med dose pack. Yeah. You know what that is? That's a med dose pack. That's a package of steroids that step down. And now we know why they're stepped it down, don't we? Yeah. See? And then they will give you a steroid inhaler. And now watch. It takes about 3 to 4 weeks of standard steroid inhalers of everyday use to adequately suppress the immune system. So now they got newer drugs, Advair, which is a short-acting steroid, and a long-acting bronchodilator, so it only takes about 2 or 3 days to suppress the immune system with Advair. That's why these drugs are really good. And then you give them the leukotriene inhibitor, Singulair, to suppress the release of leukotrienes and prevent the bronchospasm. Inhibitors, yep. Say yeah, you got that. Now watch, if you understand how this is going on, now you understand how they treat that stuff. Yes? Yes. Yes. And that's what happens is people with asthma and kids with asthma, once they start feeling better, the parents don't give them the steroid inhaler anymore. And then what happens a couple weeks later, they're back in the emergency room. But here's the other thing. No one ever tells you that. That now you're better. Right. And that'll be good for you. So you'll feel good about yourself. And then, Grace, you won't have asthma. And you won't be wheezing. Life will be good. You won't be blue. And this guy, if he ain't got, look, his eyes are blue. He ain't, look, there's no holes in his nostrils. That's why he's having a hard time breathing. Yeah. Okay, that's asthma, yep. Yeah. They usually, for kids, they usually use like, Solumedrol. It's a little weaker than prednisone. Prednisone is a badass. What's that? The leukotriene inhibitor prevents the bronchospasm, right? And it's given orally as opposed to... And here's the thing, watch. If you take a steroid like an albuterol inhaler, adults don't even know how to do it. So they stick it in there, right, like it's a crack pipe, right? They hit it, and then instead of the albuterol getting into the lungs, it hits the back of your throat. What does it do to blood vessels? That's why if you take the albuterol inhaler wrong, the back of your throat starts to hurt because you're cutting off blood flow. Then if you take the steroid inhaler, it suppresses the immune system. That's why they tell you to rinse your mouth out after you take the steroid inhaler, because if you don't, you're going to suppress the immune system in the back of your throat, and you get thrush, a fungal infection.
So what's the correct way to do an inhaler?
Yeah, like this. That's why they say this, right? You shake it, right? You hold it out a little bit. You don't suck on it, right? Then you hit it, and then no, that's why you're not. You got to let it nebulize. That's why for kids, you need that aero chamber, that spacer. But some insurance companies won't pay for it. That's why if you got a young kid, you get a freaking nebulizer. That's the best thing for them.
I would have to say that I've never seen anybody like pass an inhaler, just so you know.
Oh, I thought that's where they came here. And here's the other thing. As soon as you take a hit on it, you don't blow it out. You take a big, deep breath in to suck it in and hold it for about 10 seconds. Yeah. Yeah. Then you. What's that? Here's why. Airways that get dried out become reactive, and you can get bronchospasms, so they want the maximum dose at night. That's why you got to hydrate yourself really well. And airways become more reactive in the wintertime because the air is drier. No, it will make you drowsy, but airways become reactive at night. That's why. Like the mildest form of asthma is exercise-induced asthma. So if you go out and you start shoveling the snow, and then 10 minutes later you come back in, you'll start coughing and kind of wheezing a little bit because you're out in the cold, dry air, and that makes airways reactive. That's why if you have a kid with asthma, you make sure they're hydrated real well and they have a humidifier. And it'll be better, and they won't turn blue. So, yeah. Did that make sense? All right. I don't care if it didn't. I'm moving on. What? Singular. It's like mucosumocalast. Yeah, I don't remember those generic names. That's why I got a phone. Okay, we're doing real good. Boom, I did that. Oh, chronic bronchitis, yes? I'm killing it, man. What, you should be in your glory, right? Because you hate when I digress. No, you don't. I don't have any of those. That's a true story. I had this one student, unfortunately, she took this class like 4 times, and she goes, Tim, I know your stories are true because you tell them the same way every time.
Can you digress because they haven't heard this?
I didn't hear the real quick. I worked in Parkland's ER. So there was this one lady, and she literally lived in a van. She was so big that they couldn't get her out of the van, so she lived in a van. Anyways, they pull up to the emergency door, and the family is screaming, help, help, help. You know, my mom, she's not breathing, boom, boom, boom. So we had to cut the top of the van off in order to get her out. And we had to tie 2 hospital beds together because this lady weighed in excess of like, I don't remember, but it was like 700 pounds. Her neck was so big, and so she had so much fat in her neck that we couldn't hyperextend her neck to intubate her orally, so we had to intubate her nasally. Anyways, we got, you know, she came back around, and we were wheeling her up to the intensive care unit and trying to get her into another bed, right, that was more appropriate. So anyways, as we're rolling her over, a Twinkie comes out of her skin fold. I'm not making this up. It was wrapped, but it was smushed, right? So I have to go out and I have to talk to the husband, and he was a little overnourished himself, and I'll never forget what he said. So I was talking to him. I said, look, I'm going to be honest with you. Your wife's in pretty rough shape. Your doctor will come out and talk to you, but, at this point, we don't know. So I said, but here's the thing. When we rolled her over, we found, I found a Twinkie in one of her skin folds. And this is what he said to me. He goes, when me and the wife get frisky, we will hide food on each other and look for it. That's a true story. I could not make that up. I didn't even want to know. But here's the thing. It's like, you've seen people who are real heavy, right? You've seen that? And like, if you have to clean them and stuff, it's like their skin starts breaking down in those skin folds. And I'm like, God, that's got to be just so painful, Huh? Well, that's the thing. I'm like, look, I don't know. And I don't even want to think about it. I don't want to talk about it. I think the other thing was really heavy. We didn't lay him flat because his fat would come up and... Yeah. They had, when people lose weight, they do what's called a peniculectomy. They will have to remove that skin. Otherwise, it's literally hanging off of them, And it's like 50, hundreds of pounds of skin, and they donate it because they can use it as skin grafts. But oh God, yeah, oh yeah, it's awful. It's awful. Yeah, look, watch. You get a paper cut. So think about a giant freaking paper cut, right? Yeah. It's awful. It's awful. And here's the thing, look, watch. We laugh and stuff like that, but I don't care. Everyone's sitting here, and you can deny it. I'm not going to deny it. Everybody's got something that kind of grabs a hold of them, right? That if you let that little thing loose, your life's going to be over. People with a weight problem, you can see it. Everyone in this room got something like that, where if you don't get a hold of that little demon, it's going to ruin your life. And people with a weight problem, you can just see it. That's the difference. So, yeah. And the last thing you're going to do is make fun of people like that because look, do you think that they look in the mirror and like, yeah, you know what? I know I look good. I need to gain 50 more pounds. Yeah. But here's the thing. It's got to be something inside them that says, look, I know I'm fat. I know I'm disgusting, but I can't stop. And here's the other thing. When people get so big, it's also they have people who are helping them out. How are you going to get out of the house and get 9 pizzas when you can't even get off the chair? So you got people who are enabling them. You know what I mean? And like a lot of family members, like mothers and fathers, they go, oh, gee whiz, they're hungry. I don't want to start, right? So there's a whole stuff going on. And, look, I don't understand it because, like, if I'm eating and when I get full, I'm like, okay, I'm done. But, I've never had a weight problem, so I don't know what it's like. But it's not good.
They're like socially ostracized.
Oh, yeah.
Like, I work at Albuterol. That happened the other day. There was like a very big woman that we had the never-ending. It's over now, but we were having the never-ending classic.
Yeah.
You could order how many you want, and like I remember the table like next to like they were, you know what I mean? Like,
yeah, I know.
It's still not right because it's still her money. I mean,
look.
That guy that I saw that had that surgery, though, he was like 560 pounds. And one day he went to the doctor. He hadn't been on the skin in a long time. He said when the doctor told him he was going to die, for the next 2 weeks he came over and just ate himself. And then one day he was like, you know what? I'm done. He said he went through everything he had food in his kitchen, in the garbage, and he lost all that weight. He didn't have surgery. Every time he wanted something to eat, he walked to the store, and the store was 1.5 miles away. That's the only way he would allow himself to eat it, is he would have to get up and walk.
Watch, and you know this, it's in your own life. People do things for 2 reasons, to gain pleasure and avoid pain. And when the pain, there's not enough pain, where people make your life easy enough, when there's not enough pain, you're not going to make a change. And that's how it works. Oh, yeah. Yeah. They have this smoking cessation program that I'm running at my job, right? And I said, and there are people signed up. And I asked them, I said, what's the likelihood that you can quit smoking in the next week? Well, Tim, it's not good. It's not. I said, then I'll talk to you later. Because you're wasting your time, right? You have to make up your mind. I'm going to set a quit date, and this is the day I'm going to do it. And if you don't, there's no sense. And all this Nicoderm, nicotine, all that other stuff, all that is just another delivery method for the nicotine. It doesn't improve your chances. The only way to do it is cold turkey, where you get cold, roll it up in a cigarette, and smoke it, the cold turkey. 1, 2 people get it. That's the best way to do it. Using Nicoderm and all that other stuff, quit rate 1 month out is better with that. But 1 year out, it's identical, 9%. If you smoke, 9 out of 100 people are going to make it. The rest ain't. It's watch. Gain pleasure and avoid pain. Their maternal instinct is so strong, they can drop that like no big deal. But as soon as that fetus pops out, like, right? It's the way it is. It's the way it is. And that's why guys, if they smoke and the woman stops smoking, the guy should try to stop smoking, right? You got to put that pressure on them, right? So when my wife was pregnant, I stopped breathing for a whole 9 months. Okay, I'm going to explain to you chronic bronchitis. Guys just have no shame, do you? Do you say that to your other teachers, too? This is the only class you got? I'd like to put this class online. So as you're answering these questions, I'm like, they think that's right. I hate me, too. Okay, here I go. I really don't. You know what I think about? I think about golfing. That's what I think about. And you know what's weird? This is so weird. Like I practice my swing down my basement, and I'm almost afraid to practice outside because it feels so good when I'm practicing down the basement that I don't want to wreck that. Yeah. But, you know, it's like 10 feet away, so it's like, yeah. If the holes are 10 feet away, I'd be killing it, you know. I want to get one of those things like those computer simulated ones. They're supposed to be pretty accurate. Yeah, I know. Yeah. I'm going to buy that. You know what? You guys should do that. You should buy that. Yeah. It's like you can get a cheap one for about $35,000. Yeah.
So when we all graduate in school, our money together.
Rock on. Yeah. Yeah. That's right. Okay. You better write this down. Better not pout. Yep, I do. With this one, I do. This one's going to be on there. It's going to be on there. Because it takes a lot of things into consideration. Watch. There is, in your respiratory system, what's called the ventilation-perfusion ratio. Q, blood flow, perfusion, blood flow. Ventilation is putting air into your alveoli. You got me? Now watch. In most cases, in almost all normal cases, if you put air, right, if you put oxygen into an alveoli, you are going to send blood to that alveoli. And it makes sense, right? Now watch. If you have to pump more blood because you're exercising, you have to breathe deeper. And when you breathe deeper, you use more alveoli. Say yes. And when you use more alveoli, that will cause more blood vessels to open in the pulmonary vessels, and it will cause you to send more blood, deoxygenated blood to it, so that you can ventilate it. That's how you increase blood flow in the lungs. Now watch. Contrary or opposite to what happens in the body, the cells, low levels of oxygen in the cells and the systemic arteries. What does low levels of oxygen do to arteries? Lacking oxygen, you need more oxygen. How do you get more oxygen? By making the arteries dilate. So in the systemic circulation, low levels of oxygen will cause arteries to dilate. It is opposite in the pulmonary vessels. High levels of oxygen in the alveoli cause the pulmonary vessels to dilate, and you want that. So if you're putting more oxygen into alveoli, you want the vessels to dilate, so you send more blood to those alveoli that you're ventilating. Tell me that made sense. Boom. So watch. In people with chronic bronchitis, and the number one cause of chronic bronchitis is cigarette smoking. Cigarette, not the other one. Any of you guys cuckoo for Dopo Puffs? Are you? On the weekends? You're a little pothead, huh? Yeah. Smoking tree, ganja, chronic. What else? Yeah. I love it. I told you I only smoked pot twice in my life, right? You know what's really good are those hemostats you get at work for the roach. Those things are brilliant. The nice ones. My buddy. The hemostats. You know what I mean? The little clippy things at work. Those things are, yeah. Oh. Right? It's like a freaking party. There you go, buddy. No, the first time I smoked pot, I was 19. It was on my 19th birthday. Right? And everything's funny. Everything's funny. My mom's having surgery, right? My buddy goes, my mom's having heart surgery. That's funny. He goes, you're stoned. The next time I'm coming home from a bus trip from a baseball game in college, University of Minnesota. So I was like a sophomore on the baseball team, and the juniors and seniors got to ride on a different bus with no coaches, and the sophomore and freshmen had to ride with the coaches. So they go, Tim, if you win today, you can drive home on the bus with us, and we'll smoke a little pot. I'm like, yeah. So I'm pitching my heart out, right? Anyways, I ended up winning, so we're on the bus home, right? And I'm sitting up in front. So they're passing it around, right? So I can take a couple hits off of it. Then like 10 minutes later, I'm like, stop throwing stuff at me. They're like, nobody's throwing anything at you. And I'm like, knock it off. And then we'd always stop at a restaurant before we went home, right? So I go to the captain. I'm like, I can't go in there. And he's like, why? Everybody's going to know I'm high. I go, just bring my food out here. And that was the last time I smoked the pot. Well, I take that back. My nephew came over, right? And he's like, oh, Tim, you want to smoke a little pot? And I was married at the time, and I thought, I don't care about smoking pot, but maybe if I give the X a little, she'll mellow out, right? I don't know what the hell was in there, but I took 2 hits off that thing. My heart starts racing. I start sweating. I'm like, that's what you guys like? What happened to laughing? Yeah, Timmy don't do that no more. Just a couple of... Okay, now watch. Yeah, I like those. Okay, here we go. Watch. Smoking does several things. Number one, it paralyzes cilia. Number two, it causes hypertrophy of goblet cells. What do goblet cells produce? Yeah, goblets. So watch. What happens is mucus starts building up. You got me? Now, in chronic bronchitis, there is a ventilation-perfusion mismatch. for unknown reasons, you still perfuse alveoli that you don't ventilate. So if you don't get any oxygen in, can you remove any carbon dioxide if it's blocked by this big green mucus plug? No. So, and air always takes the path of least resistance, just like blood. So air is going to bypass that, and you're going to cause oxygen to come in this alveoli, and CO2 is able to be removed. So you're going to oxygenate this blood and remove the carbon dioxide. But are you going to be able to oxygenate this blood and remove the CO2 here? So what's going to happen to the overall PO2, oxygen saturation, and PCO2 of the blood in someone with chronic bronchitis? Very good. Down, down, up. Down, down, up. You got me? Now, if you recall, the buildup of carbon dioxide in arterial blood will diffuse from the arterial blood into the cerebrospinal fluid, and what will happen to the amount of hydrogen ions? It will go up, and it's the hydrogen ions that stimulate breathing. What happens in people with chronic bronchitis is those chemoreceptors in the medulla become desensitized to high levels of PCO2. Over time, the medulla simply gets used to that high level of PC because it's chronic. It's chronic. Say yes. But we learned, and I'll never forget it, we learned that you have peripheral chemoreceptors. And these peripheral chemoreceptors respond to low levels of PO2. So the reason these people breathe, and people with chronic bronchitis, is because of low levels of PO2. Who's with me? So if you give a person with chronic bronchitis high levels of oxygen, that will increase their PO2. What's their stimulus for breathing? So if you elevate their PO2, you will no longer give them a stimulus to breathe. So they will stop breathing. Say yes. That's why you have to be careful in terms of the amount of oxygen you give a person with chronic bronchitis, because it will take away their drive to breathe. Say, yeah, you got that. I told you about the refrigerator nurse? No. Real quick. Look, I worked in Parkland, so it was busy. So this refrigerator nurse, she was a nurse where she picked up a couple of shifts if she wanted to buy a new refrigerator, but she didn't work full-time as a nurse. So she took this patient in, and I didn't know what was going on, so she put the lady on, like, I don't know, a bunch of oxygen, and then she leaves the room. And I'm doing my thing, right, and I walk past the lady's room, and I see her like this. And I kind of timed it, and she breathed like twice in a minute. And watch how smart I am. I go, that ain't right. So I went and looked at the lady's chart and said chronic bronchitis times 20 years. So I went and looked at the amount of oxygen she was getting. She cranked her up to like 6-7 liters of oxygen. I turned it down to like 2 liters, and she woke up. Because they breathe because of hypoxia, lack of oxygen. If you give them too much oxygen, it takes away their drive to breathe. That's why you have to limit the amount of oxygen given to someone who has chronic bronchitis. Say yeah. Rock on. Did I explain to you the surfactant? Yep, you know this. You have to know this, right? You learn this. Yep. Watch. Watch. Right. So, no. They're going to be much more particular. So if you recall, right, and don't ever say that the baby's lungs are fully developed. They are. That's right. So we have in our alveoli, we have these specialized cells that line the alveoli. Whoops, hang on. And those specialized cells that line the alveoli are called type 2 alveolar cells. And these cells produce a substance called surfactant. And surfactant prevents alveoli, the walls, from sticking together. How you create that surfactant is by expanding alveoli. So when a little kid pops out, they slap them on the butt and the kid's like, what the? So when they take the breath in, you're going to expand the alveoli, and the type 2 alveolar cells are going to produce that surfactant. And basically what surfactant does is prevents the water molecules that are in the alveoli from sticking together. You got me? And babies don't start producing that until the 7th month of gestation. Now, back in the day, if a baby was born before the 7th month, chances are they weren't going to make it. But now they have little baby ventilators where they can intubate the kid and they can allow the kid to survive. That's why kids that are born like, 5, 6 months, 4.5 months, that weigh 1.5 pounds are actually surviving and living because of these little pediatric ventilators. And they, what they do is they use this setting on the ventilator called PEEP. And it's appropriate given that time of year, Easter time. They actually stick those little marshmallow treats down the ET tube. PEEP is called positive end expiratory pressure. So as the baby breathes out, the ventilator puts a little positive pressure in there so that when they blow the breath out, that positive end expiratory pressure prevents the alveoli from completely collapsing. That's called PEEP, as opposed to CPAP, which is continuous positive airway pressure. So you get the little elephant's nose if you snore, right? PEEP is different. It's at the end of expiration to prevent the alveoli from sticking together. And now, if they know the baby's coming early, like you got twins, and they know they're going to take them early, they will actually give them synthetic surfactant so that the little babies start producing it after they, before they pop out. And if they can't, right, if the baby comes early, they can actually put synthetic surfactant down the ET tube so the baby doesn't have to stay on the ventilator for a prolonged period of time. And the longer someone is ventilated, especially a baby, the less likely they're gonna make it. And almost invariably, these kids that are born premature, they have respiratory problems. That's the nature of the beast. That's why. There's a condition called alpha-1 antitrypsin deficiency where people have a genetic lack of surfactant. And they usually die before the age of 40 because of, and look, you're going to start learning some terms. Collapsed alveoli that can't reinflate have a name. They're called collapsed alveoli that can't reinflate. It's called atelectasis. Have you ever heard of atelectasis? Yes, you do. You need to know that term. Just write it next to your name. That would be, no, that sounds like a kid's name. Atelectasis. Right. What? Atelectasis is where the alveoli start collapsing and you can't reinflate them. Say yeah. Okay, ambulate home. We did real good. Can you listen to me? Listen to me. Print off that kidney stuff for Wednesday. You follow? And then please do me a favor. On online or on the Timmy videos, look. There's a pulmonary function. The pulmonary function question, that's going to be extra credit.
So number 16?
Yep.
So number 11 and number 16 are extra.
Yeah, and but I'm going to explain number 16. Yeah, you guys know all those extra credit, don't you? What? Yes. Yeah. Watch, on the midterm, I'm not going to mention it. You have to mention it to me, or otherwise I'm going to kick your fatty acid out of there. Yeah. Yeah, you